We're now joined by Aly Maier Lokuta, who is Senior Director of Arts and Wellbeing at NJPAC, New Jersey Performing Arts Center. Good to see you, Aly.
Thank you for having me.
Aly, is it not a fact that you told our producer, Georgette, that, quote, the arts are good for our health? And if so, what exactly does that mean?
That is a fact. I think anecdotally, kind of instinctually, we can all think about a time where engaging with the arts made us feel good, whether that's going to see a play or a concert, going to a museum, or even singing in the shower. But now there's research and evidence that points to physical and mental health benefits of the arts. For example, going to a museum or concert just once or twice a month can lower depression in adults by 48%.
Along those lines, I'm curious about this because COVID, we're doing this program in late 2022, be seen a little bit later. The level of isolation that people have experienced is just extraordinary. And the arts were delivered in all kinds of ways, virtual, hybrid, all kinds of ways. Connect the issue of the arts with isolation and loneliness for people, please.
Well, the arts are a great solve to loneliness. The arts offer pathways to connection, communication. They bring us together and help us understand what each other are going through and what we're feeling. They can help us process grief. The arts have been used immensely with healthcare workers, for example, over the past 2 years to help them with burnout, stress, and grief processing. And they can be helpful in our communities too, in social justice issues to bring.
How so?
Bringing people together to have tough conversations using the arts as a pathway to understanding. When folks engage using the arts, it's often through messaging that's culturally relevant and responsive, helping us understand one another's perspectives.
Along those lines, to Aly and her team, along with John Schreiber, the leader at NJPAC, there have been so many conversations around tough issues. There was a series just a few years back around police relations in the minority community. Tough, important, substantive. Forget about timely, because unfortunately it's always timely. That's what you're talking about, isn't it? And people say, well, that's not the arts. It is. And some people don't think this is the arts. It is. Go ahead, Aly.
It is. It's the arts, and it's arts in health, which is a broader field that this work is a part of, whether that's social justice, health communication, arts in healthcare, or arts in our communities. It's part of a broader conversation and a field of study now that points to the evidence of its benefits.
Talk about our kids' arts education and the wellness issues that you're talking about, particularly for young people.
Well, it's imperative right now that we get the arts and we have students able to access the arts in schools. We really see arts education as a public health issue. The data now points to engagement in the arts being able to reduce social isolation and loneliness in adolescents and youth, reduce depression. And as we see the facts and figures of the impact of the pandemic on our students, it's more important than ever that we give our students these outlets to connect with one another and to process what they've been going through.
Aly, I want to talk about social prescribing in just a minute, but do this for us because it's the first time you've joined us, and I want to make sure people understand. Where do you come from originally, and how did you get into this field?
Sure. So I'm a visual artist by practice, a photographer in undergrad, and I discovered this field through the University of Florida Center for Arts and Medicine, which has a master's program at this intersection. So I have an MA in arts and medicine, studying the—
1 second, arts and medicine, it's a concentration? It is?
It is, yes. And it's—
go ahead, I'm sorry, because I'm curious as to how we get you at NJPAC.
So I moved to New York. I've been back and forth to New York a couple of times, but most recently in 2019, when New York City Health and Hospitals was starting their arts and medicine department and was the arts program manager and assistant director of that program.
And then we recruited you into NJPAC, right?
Yes, that's correct.
What is the social prescribing program?
So this is a really innovative program that allows doctors, physicians, community health workers to prescribe things outside of their normal clinical services and connect people with their social needs in their community, and in particular, arts and culture. So we're developing a pilot with our partners at RWJ-Barnabas and the Horizon Foundation of New Jersey to enable their providers to prescribe arts to their patients.
And the impact of such a program is?
We'll be looking to measure it. What we know is that this provides pathways to care. It provides folks with an opportunity to engage with creative activities in their communities where they are. If we know that, for example, attending a concert or museum can reduce your risk of depression or reduce your risk of hypertension, then by prescribing people free tickets to those things, we can reduce the incidence of that in the community.
It's so interesting. People, again, I'm not in any way being critical of prescribing medication, but it's not the only way to deal with some of the issues that Aly's talking about. To you, Aly, to our longtime friends and colleagues at New Jersey Performing Arts Center, downtown Newark, check it out. Make sure we put up their website. Make sure the website has been up in post-production so people can find out not only about the programs going on, arts education efforts, but also the performances that go on there. If I'm not mistaken, the recent 25th anniversary of NJPAC, is that correct?
Yes, our 25th anniversary.
I saw the picture of Savion Glover, who was a little kid. Talk about a great dancer, talk about a great artist. He was a little kid there first night, and then he was there for the 25th. Anyway, that's two inside. I want to thank you so much for joining us, Aly. Wish you and the team at NJPAC all the best.
Thank you so much, Steve.
You got it. That's Aly. I'm Steve. Thanks for watching. We'll see you next time.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by the New Jersey Education Association, the Turrell Fund, supporting Reimagine Childcare, Horizon Blue Cross Blue Shield of New Jersey, RWJ-Barnabas Health. Let's be healthy together. Summit Health, the Healthcare Foundation of New Jersey, PSE&G, Newark Board of Education, and by PSEG Foundation. Promotional support provided by Meadowlands Chamber and by New Jersey Monthly.
New Jersey is home to the best public schools in the nation, and that didn't happen by accident. It's the result of parents, educators, and communities working together year after year to give our students a world-class education, no matter the challenge. Because parents and educators know that with a shared commitment to our public schools, our children can learn, grow, and thrive. And together, we can keep New Jersey's public schools the best in the nation.